High creatinine, 3 fruits you should eat, and 3 you should never touch. Are you accidentally eating fruits that are making your creatinine levels higher every day? It may sound harmless, but just a few wrong fruits can be enough to overwork your kidneys. And if your creatinine is creeping up, it's no coincidence. Your kidneys are trying to send you a clear signal. Today, I want to help you understand that. In this video, I'll show you 3 fruits that are really good for reducing the burden on your kidneys, and 3 that you should absolutely avoid if you don't want your creatinine to continue to rise. Many people think fruit is good, but with weak kidneys, some fruits are a silent danger. I've been working with kidney patients for over 15 years, and I've seen too many people accidentally make their condition worse just by choosing the wrong fruits. So I want you to understand this in a clear, easy to understand, and immediately applicable way. And at the end of the video, I'll share a little known but incredibly kidney supporting tip. It's not a food, but it's more effective than you might think. Stay until the end because it can make a real difference to your health. Number 1, cranberries. When people talk about cranberries, they usually think about bladder health or UTI prevention. But what most people don't realize is how much this tiny red fruit can actually help your kidneys too, especially if you're in the early stages of kidney problems. Cranberries contain a special compound called proanthocyanidins. It sounds complicated, but what it really does is simple and powerful. It stops harmful bacteria from sticking to the walls of your urinary tract. If those bacteria can't stick, they can't cause infections that move up toward your kidneys and make everything worse. For someone trying to keep creatinine from rising, avoiding these infections is a huge win. Cranberries also have strong anti-inflammatory effects, and that matters more than most people think. Inflammation inside the kidneys can show up as protein leaking into your urine, which is one of the earliest signs your kidneys are under stress. By calming that inflammation down, cranberries give your kidneys room to recover and breathe a little. Some studies even show that cranberry extract or diluted cranberry juice can help lower the chances of infection and swelling without adding extra burden to weak kidneys. And that's exactly what you want when your creatinine is creeping up. Another reason cranberries are so kidney-friendly is their nutrition profile. 1 cup of fresh cranberries has only about 46 calories and just 85 milligrams of potassium. For anyone who has to watch their potassium closely, that number is very safe. And because they're high in vitamin C and fiber, they support the immune system and help regulate digestion, both of which indirectly help your kidneys handle less waste. But the form you choose matters a lot. Pure, unsweetened cranberry juice is the best option, and it's even safer when diluted with water. If you like dried cranberries, go for unsweetened ones and keep your portions small. And stay away from cranberry cocktails or foods that only have cranberry flavor. They're usually full of sugar and barely have any real fruit in them, which does more harm than good. Cranberries can be a simple, gentle way to support your kidneys if you pick the right kind and use them the right way. Number 2, apple. Apples look simple, but they're one of the most helpful fruits you can choose when your kidneys are under stress. A lot of people overlook them because they seem too basic, but apples quietly do things for your body that really matter when you're trying to keep creatinine under control. One of the biggest reasons apples are so good for kidney health is a type of soluble fiber called pectin. Pectin works like a gentle cleaner that moves through your gut and binds to cholesterol, toxins, and even heavy metals that would otherwise end up floating around in your blood. When your kidneys are already working hard, having less waste to filter can make a real difference, and apples help reduce that load in a natural, painless way. Another thing that makes apples so safe is their potassium level. A small apple only has around 195 milligrams of potassium, which is low enough for most people with kidney issues, even those who need to monitor their potassium closely. But apples don't stop there. They also contain a plant compound called fluoridin. It's not a word you hear every day, but what it does is pretty amazing. Fluoridin helps reduce oxidative stress inside kidney tissue, which is basically the kind of wear and tear that slowly damages the filtering units in your kidneys. Eating an apple a day might sound like a simple habit, but for someone trying to protect their kidneys, it can be a steady source of support. If you struggle with digestion or need to limit phosphorus, Peeling the apple is completely fine. You still get most of the benefits without putting extra pressure on your body. You can enjoy apples raw, baked, or even turned into a soothing apple cinnamon drink by simmering sliced apples in water. Just be careful with processed forms of apples, like canned apples, store-bought apple juice, or sweetened dried apples. These usually come with added sugar or preservatives that are tough on your kidneys. Sticking to whole, fresh apples is the safest and most helpful choice. They're cheap, easy to find, and surprisingly powerful for something so simple, and that's exactly why they deserve a place on your kidney-safe list. Number 3, lime. Limes are one of those small fruits people often overlook, but they can make a real difference when you're trying to protect your kidneys and keep your creatinine from climbing higher. What makes limes so special is the natural citric acid inside them. This acid isn't the harsh kind people sometimes worry about. It actually works in your favor. Citric acid can bind to calcium in your urine, stopping crystals from forming and turning into kidney stones. Kidney stones put a lot of pressure on your kidneys and can cause sudden spikes in pain, inflammation, and stress, so having a simple way to lower that risk is a huge advantage. Limes also help your body create a more gentle, alkaline environment, which can slow down the progression of kidney problems in many people. That might sound small, but when your kidneys are struggling, every bit of support matters. Nutritionally, limes are incredibly kidney-friendly. One lime has only about 68 milligrams of potassium, which is low enough for those who need to monitor potassium intake carefully. It also gives you around 22% of your daily vitamin C, helping your immune system stay strong without overloading your kidneys. The best and easiest way to use limes is to squeeze half a lime into a glass of water and drink it before meals. It's refreshing, gentle, and helps with digestion. Many people feel less bloated and more hydrated just by adding this simple habit to their day, and it's something your kidneys quietly appreciate. But you need to choose the right kind of lime product. Avoid bottled lime juice because it usually contains preservatives and added acids, and it loses a lot of its natural benefits once it sits on a shelf for too long. Even though lime water is great, it's still important not to overdo it. Drinking too much concentrated lime juice can wear down your tooth enamel and irritate your stomach. You don't need large amounts to get the benefits. Small, steady use is more than enough. Fresh limes are cheap, easy to find, and surprisingly powerful for such a tiny fruit. If you're looking for something simple and natural to support your kidneys each day, lime water is one of the easiest habits to start, and it can give your body a gentle lift right when it needs it most. Now that you know cranberries, apples, and lime can really support your kidneys and help lower creatinine naturally, it's time to pay attention to what not to eat. Stay tuned because we're about to reveal why these fruits can be dangerous and how to avoid them safely. Number 1, avocado. Avocados are loved everywhere, and most people see them as one of the healthiest foods you can eat. But when your kidneys aren't working the way they should, avocados can quietly become a real problem. What many people don't realize is just how much potassium is packed inside this one fruit. In only 100 grams of avocado, there are about 708 milligrams of potassium. That is a huge amount for someone with kidney issues, and even half an avocado can push you past your safe daily limit without you noticing. When potassium builds up in the blood because the kidneys can't remove it fast enough, it can lead to muscle weakness, heavy fatigue, and in more serious situations, dangerous changes in heart rhythm. This is why people with high creatinine need to be especially careful with foods that look healthy on the outside but hide risks on the inside. Another thing that makes avocados tricky is how often they're paired with salty foods. Think about avocado toast, guacamole with chips, or avocado added to a sandwich. The fruit itself is already high in potassium, and then the bread, chips, or seasonings add more sodium on top of that. High potassium and high sodium together create a heavy load for weakened kidneys, and it can slowly make creatinine rise even more. A lot of kidney patients end up eating these meals thinking they're doing something good for their body, when in reality, they're putting extra pressure on their kidneys every single day. Even store-bought guacamole can be a hidden danger because many brands use potassium-based preservatives to keep the color fresh for longer. Those preservatives silently add more potassium to your diet without you knowing. The truth is, people often assume healthy food means safe food, but when it comes to kidney problems, that rule doesn't always apply. Avocados are a perfect example of a food that is great for the general population, but risky for anyone dealing with high creatinine or low kidney function. If your kidneys need a break, avoiding avocados or eating them only under your doctor's guidance is one of the simplest and most effective choices you can make. Your kidneys are already working hard. The last thing they need is another hidden burden. Number two, grapes. Grapes look harmless, and a lot of people think of them as an easy, quick snack. But when your creatinine is high or your kidneys are working slower than they should, grapes can create problems you don't see coming. The first issue is their sugar content. Grapes may taste light, but they're one of the fruits with the highest natural sugar levels. When your kidneys are weak, handling that extra sugar means handling extra metabolic waste, and that puts more pressure on the kidneys to filter everything out. On top of that, a single cup of grapes contains around 288 milligrams of potassium. Most people eat more than one cup without even realizing it, especially because grapes are the kind of fruit you snack on mindlessly, grabbing handful after handful until half the bunch is gone. That easy snack can push your potassium level much higher than you expected, and high potassium is something people with kidney problems have to take seriously. Grape juice makes all of this even worse. Juice is basically the sugar and potassium from several cups of grapes squeezed into one small glass. When everything is concentrated like that, your blood sugar jumps faster, and your kidneys have to deal with more waste in a shorter amount of time. Raisins are even more dangerous because they shrink down, but keep all the sugar and potassium. So a tiny handful can contain the same amount you get from a huge serving of fresh grapes. And for anyone who enjoys wine, it's important to understand that wine still contains potassium, sugar, and alcohol, all of which have to be processed by the kidneys. Even small amounts can add stress if your creatinine is already rising. If your doctor allows you to eat grapes, the safest way is to limit yourself to just 5 or 6 grapes and always eat them with a full meal so the sugar doesn't hit your system too fast. Grapes aren't bad, but for someone with kidney issues, the portion size matters more than anything. Understanding these small details can help you avoid accidental strain on your kidneys and keep your creatinine from climbing higher without you realizing why. Number three, star fruit. Star fruit is, without question, one of the most dangerous fruits for anyone with kidney problems, and many people have no idea how risky it truly is. Star fruit contains a toxin called caramboxin, and while healthy kidneys can filter it out, weak kidneys cannot. When the toxin stays in the body, it can affect the brain and nerves in a very serious way. There have been cases where just 100 milliliters of star fruit juice caused symptoms like confusion, nonstop hiccups, muscle twitching, seizures, and in the worst situations, even coma in kidney patients. These reactions don't happen because someone drank a lot. They happen because their kidneys simply can't get rid of the toxin, so it builds up quickly. That's what makes star fruit so scary. It doesn't take a large amount to cause harm. What makes things even more dangerous is that star fruit shows up in more places than people realize. It's not just the whole fruit sold at markets. Star fruit is often added to mixed juices, herbal teas, smoothie packs, and fruit blends without being clearly labeled. Someone with high creatinine or reduced kidney function could be drinking or eating it without knowing, thinking they're choosing something healthy. The flavor of star fruit is mild enough that it can hide in a mixture, and by the time symptoms appear, it's too late to undo the damage. Hospital reports have shown that even patients who are stable on dialysis can develop severe reactions after eating just a small slice. For someone in late-stage kidney disease, even one bite can be dangerous. The hardest part is that most people think of fruit as harmless. They assume all fruit is good for them, and they repeat old sayings like, fruit is always healthy. But star fruit is the exception, one of the very few fruits that can turn dangerous almost immediately for anyone with impaired kidney function. If your creatinine is high, or if a doctor has ever told you that your kidneys need to be protected, the safest choice is to avoid star fruit completely. Your kidneys already have enough weight to carry, and this is one fruit that can add more risk than you ever imagined. Number 4. Additional tip. Drinking water might seem simple, but when it comes to protecting your kidneys and managing high creatinine, how you drink can make a huge difference. Many people think that chugging a large amount of water all at once will flush out toxins faster, but for someone with kidney problems, this can actually be harmful. Drinking too much water in a short period can dilute the sodium in your blood, a condition called hyponatremia, which can cause muscle weakness, confusion, dizziness, or in serious cases, even seizures or other complications. That's why it's so important to drink small amounts steadily throughout the day rather than trying to force hydration all at once. A safe guideline for most people is about 30 to 35 milliliters of water per kilogram of body weight daily, unless your doctor has told you to restrict fluids for medical reasons. This method keeps your body balanced and helps your kidneys handle waste more efficiently without adding stress. Another tip that makes a big difference is combining hydration with light movement. For example, taking a short walk for 5 to 10 minutes after drinking a glass of water can improve circulation and help your body distribute fluids more evenly. This gentle movement allows your kidneys to process waste more naturally instead of being overloaded all at once. Staying consistently hydrated in this way supports kidney function and may help prevent sudden spikes in creatinine. It's also helpful to use reminders, water bottles with measurements, or even apps to keep track of your intake throughout the day. Simple habits like sipping water regularly and moving lightly afterward might not feel dramatic, but over time, they can quietly make a huge difference in kidney health, reducing strain and supporting overall well-being. The goal is consistency, not speed. Your kidneys are already working hard to filter waste and maintain balance, so helping them with steady hydration and light activity gives them the best chance to do their job without extra burden. Over time, this small adjustment can protect your kidneys, keep your sodium levels safe, and make your body feel more energized and balanced, which is exactly what you need when managing high creatinine. Number 5, bonus tips. Here's a bonus tip that many people never think about, yet it can quietly support your kidney health in a gentle and relaxing way. Epsom salt foot soaks. You might be surprised to learn that magnesium sulfate, the main ingredient in Epsom salt, can be absorbed through your skin. This means that just by soaking your feet, you're giving your body a small, soothing boost of magnesium, a mineral that many people with kidney concerns are often low in. Magnesium is important because it can help reduce muscle cramps, fatigue, and even support healthy blood pressure levels. But that's not all. Soaking your feet in warm water with Epsom salt for about 15 to 20 minutes, 2 to 3 times per week, also encourages relaxation and improves circulation, helping your body move fluids more effectively. Better circulation means your kidneys don't have to work as hard to filter blood, and it can indirectly reduce stress on these vital organs. Beyond the physical benefits, this simple practice can be a mindful, calming ritual, a moment to slow down, breathe, and care for yourself in a way that directly impacts your overall well-being. However, there are a few precautions to keep in mind. If you have diabetes, open wounds, or skin conditions on your feet, it's essential to check with your doctor before trying this because the soak could cause complications if used incorrectly. Also, avoid soaking your feet in water that is too hot or staying in the water too long, as this could lead to dizziness or changes in blood pressure. Using pure, fragrance-free Epsom salt is key. Scented or colored products can irritate your skin and reduce the benefits. Despite being a small, simple practice, Epsom salt foot soaks offer a surprisingly effective way to support your kidneys, relieve tension, and even improve circulation and relaxation, all without putting extra strain on your body. Over time, this ritual can complement the healthy eating habits and proper hydration we've already discussed, creating a holistic approach to kidney care that nourishes both body and mind and gives your kidneys the quiet support they truly deserve. Cranberries, apples, and lime support kidney health, while avocado, grapes, and starfruit can harm it. Drinking water steadily and Epsom salt foot soaks help reduce creatinine and ease kidney stress. Start with smart fruit choices daily and watch your kidneys thrive. For more tips, check out our next video.